and welcome. Welcome, College of Public Health family. Thank you for joining us tonight in this discussion about public health after 2020. I'm Dr. Teresa Long, and I will be your host for tonight's panel discussion. I'm honored to be a part of the CPH, the College of Public Health family, after having retired as Health Commissioner for the City of Columbus, the other CPH, Columbus Public Health. So it's great to be with you tonight. A few housekeeping details before we get started. This session is being recorded and will be available on the CPH website next week. Live closed captioning is being provided throughout the duration of this webinar. Please just click on the button right at the bottom of your screen to turn on this feature. We are also so grateful to have received a number of questions from attendees during the sign-up process. We've done the best we can to combine and address some of these during our discussion, and we'll tackle some of them as we get to the end in a more direct Q&A. But that said, we couldn't get to all of them. So again, my apologies in advance if we're unable to get to yours. And thank you for submitting such great questions. And now, without any further ado, I'd like to introduce you to our three panelists. Welcome, Dr. Amy Acton. Dr. Acton is the two-time Ohio State alumni who currently serves as the Director of Kind Columbus at the Columbus Foundation. She is dedicated to spreading words and actions of kindness as the defining value in our region. Dr. Acton is also a licensed physician and preventive medicine specialist. Before her current role, Dr. Acton served as the Director of the Ohio Department of Health during the COVID-19 pandemic. It is also important to note that Dr. Acton was one of two CPH alumni this year to be honored with the Ohio State Alumni Awards. She was honored and awarded with the Alumni Medalist Award, the highest honor bestowed by the Alumni Association. Congratulations. And receiving the Diversity Champion Award was Mr. Dwayne Reynolds. In addition to being a Masters of Health Administration alum, Dwayne Reynolds is the founder and CEO of Just Health Collective. Just Health Collective guides organizations in creating cultures of belonging, enabling a fair and just opportunity for everyone to achieve optimal health. Before founding Just Health Collective, Dwayne has had multiple different key roles, including serving as the president and CEO of the American Hospital Association's Institute for Diversity and Health Equity. Welcome, Dwayne, and congratulations to you both. And finally, but not finally, please welcome Dean Amy Fairchild. Dean Fairchild is deeply concerned with the quality of evidence that is used to support interventions for the common good, including during pandemics such as the current COVID-19 crisis. Dean Fairchild has played a key role in advising campus leadership during Ohio State's response to the pandemic and currently leads the expert team monitoring COVID-19 on and around campus and providing evidence-based recommendations to slow the spread of the virus and keep campus safe. Welcome, welcome, and thank you all for being here. So with that, we're going to get going right away and jump right into it. So Dr. Acton, we're starting with a question for you received from one of our participants, one of our guests. At a watershed moment, facing both COVID-19 and racism as public health crises, we proudly watched you and our state take the lead. How can we ensure that public health remains a priority in our communities and our government?
Thank you. Good evening, everyone. I am so grateful to be here tonight, and I'm a little bit passionate to talk about this subject. And by way of background, I want to tell you, I never imagined that I would be the director of the Ohio Department of Health. I was actually working where I do now, the Columbus Foundation, happily seeing my retirement and living out my days here in my community when I got a very strange, unexpected phone call from the governor. And I remember going in thinking, there's no way, I've never been involved in politics. I've never done anything quite like this. You know, why would he pick me? So I was very honest with him, and I talked about my passions for public health. And really a punchline that had been the punchline since my class. I taught for many years at Ohio State, an intro to global public health. in my work here. And that is that I really felt the ultimate vision for public health was to create the conditions in which all people, all Ohioans have the opportunity to flourish and contribute to their fullest potential. And I said that I really saw it as, you know, we can't just have economic development, but we really have to have human development. And that when everyone is giving their gifts, we all rise. It's not a zero-sum game, but these things are so intertwined. And this actually came up in the pandemic. Is it health or economic? It's all of it. And he was so passionate about it. He'd had these experiences working in Haiti that I realized that we had this unique opportunity to really try to modernize public health. And then we had this wonderful new dean join, and I just started to see that there were stars aligning. So I'm going to say this will be my longest answer. But what we did is we decided that we were going to follow the 3.0 blueprint, and working side by side with my colleagues and all the local health departments. If folks don't know, there's 113 local, home rule state health departments, really with their own jurisdictions, a state health department with 1,100 employees, and the state budget that is less than 10% state budget. It's mostly federal dollars. So to modernize, which I believe the crisis of the pandemic has only revealed more and is a tremendous opportunity. The way forward, I really believe, is we become chief health strategists. It's very interdisciplinary. That's what I love about public health. It's never one person alone. It's teams of people being convened, one, chief health strategists, using the best data analytics possible. You know, in the pandemic, we didn't have the ability to do some of the data we do. We leaned on OSU and other partners to help us do that. Great data analytics with a state health improvement plan, our CHAS, our SHIPs. Then state-of-the-art communications, which again, we're out so much in this pandemic as being crucial, how we educate and bring people along. Fourth is new structures. And we're really starting to explore ways of having academic partnerships, academic public health department with students embedded in it, but also that we might look at ways of having a system. We are right now a state and local, and we really wanted to maybe even pay so that employees were joint employees. We can no longer, we need to be lean, so we might hire, you know, doctors, physicians, and nurses from healthcare, from federally qualified health centers, and instead of them actually being employees all the time of ODH. All these new ways of structuring. But finally, most importantly, you know, we made a deputy level position for dealing with equity and the social determinants of health, and that everything we would do would have that lens. So academic public health departments, and we actually did one last thing. We created a foundation in the first budget. I don't know how we pulled this off, but there have to be these more lithe structures where we bring business, nonprofits, the communities, hospitals, everyone around the table to solve issues. So to me, and to sum it all up, I can tell you the time is right. It continues to be right. If we use what we've learned during this pandemic with the partners in Ohio, I believe, you know, with this administration as well, there's a tremendous opportunity for Ohio to move forward.
Okay, Chief Health Strategist number one, lots of other things to think about. I'm liking that, that's great. So thanks, Amy. And on to you, Mr. Reynolds. So in February 2020, you founded Just Health Collective, an organization helping to build a just healthcare system. Get that, February 2020, that is fair, impartial, a healthcare system that is fair, impartial, and representative of the community. COVID-19 has clearly shined an even brighter light on health inequities in America. Tell us how you're actually working in this space and what steps we can take to break down the structural inequities that we see in healthcare.
Thank you. First of all, it is such a pleasure for me to be with all of you this evening. I just continue to be so heartened by Ohio State and the connections that I have with the university. And so I'm just thrilled to be here with you all. So in terms of Just Health Collective and starting a company amidst a pandemic, obviously I didn't see it coming, but I will tell you that the work of health equity, diversity, and inclusion has been very much a part of who I am all throughout my career, and really started when I was in the school, actually the College of Public Health back then, in the Masters of Health Administration program. I remember being in an introduction to health services management and learning about a patient who was a part of the Hmong community, and she had severe epilepsy and her family struggled with the interactions that she had within the healthcare system because they were not used to Western medicine, nor did they speak our language. And it really gave me insight into the fact that not everyone experiences our healthcare system equally or equitably. And it just sort of ignited a flame in me to really try and understand that a bit more. And particularly in leadership within hospitals, it is still primarily white males who are at the top of hospital organizations. We've tried very hard in our industry to make shifts in that, but it still remains fairly low at about 13% in terms of people of color. And so what I knew was that as I saw the healthcare system, we had some changes to make relative to the representation of individuals of color and of women in leadership positions, because that mattered to how we run the organizations, how we connect with our community, how we understand the needs of our community. And I felt like I wanted to do something about that. Now, I was probably a very non-traditional sort of healthcare administration student, because back then, diversity and inclusion and trying to move that and be a hospital administrator was not really a fit. And so I felt like I had to pave my own way. And it's so interesting, and this is one thing I want to share with the students, it's so interesting how you will come out trying to figure out where you fit and trying to understand your passion and your purpose. But in reality, what happens is you are drawn to it. It is drawn to you. So those things that continually just show up on your doorstep are the things that you probably ought to be doing. And when you step into that space, doors will be opened, barriers will be removed, and you'll be doing your best work. And so Just Health Collective is the answer to my lifelong trying to figure out where I belonged. But along the way, I was in faculty practice administration in academic medical centers and organizational development and management consulting, never really thinking that I was amassing the skills that would lead me to Just Health Collective. And so in terms of the second part of your question, what do I believe people can do to really change structural inequities? I think it first starts with yourself, understanding that we are part of a larger system that, quite frankly, has systemic racism as a part of its core. And that has an impact on who we are and how we show up. So first, we need to learn ourselves, our own unconscious bias, our own sort of internalized experiences that hold us back from contributing in the way that we should. Once we do that, and in thinking about our role as public health leaders, we really have to stop and understand the implications that our history has today as it relates to social determinants of health and health disparity. And it is our opportunity now to really pave the way for a new healthcare system, one that is just, one that is equitable.
Wow. Again, just quote, getting started, starting the company. You've been about it for a long time. I really appreciate your thoughts about the where do I fit and paying attention to that, paying attention to the stories in your life. They're unfolding right before you. That's really powerful. So Dean Fairchild, COVID-19 has been labeled as a once in a lifetime or once in a century. We'll start with that, once in a century pandemic. As a public health historian, do you believe this to be true? And what are the steps that we should be taking now to prepare for possible future pandemics in our lifetimes and beyond?
Thank you, Teresa. And before I answer your question, let me first start by expressing my profound thanks to both Amy and Dwayne. I'm here tonight because I've had the opportunities throughout my career to stand on the shoulder of giants. How special is it for the university to recognize not just one, but two of our giants in 1 year? So Amy, Dwayne, thank you. And I know your shoulders are broad enough to bear our collective weight, but I had to start with that. So in terms of a once in a lifetime event, a once in a century event, there's no question that to those of us in the midst of it, those of us who are experiencing the fear of the loss of friends or family, who have lost friends, family, loved ones, we've got to tell ourselves this is a once in a lifetime event, and that has to be our goal, to make it a once in a lifetime event. But it would be a mistake to think of it in that way. So during my career alone, and Dr. Acton, you're going to have lived through some of these same things. My career began with the AIDS pandemic. I lived through the rise of extremely drug-resistant tuberculosis, new emerging infections like Ebola, Zika, SARS, MERS. And as a historian, I've studied not only those outbreak moments, but also polio, pandemic influenza in 1918, where we hear a lot of comparisons today, smallpox. So there's no question that COVID-19 is perhaps the most devastating from a global economic perspective, and it's certainly devastating from a global public health perspective. And we've got a long way to go. And one of the ways we've been able to wrestle with this pandemic, as well as we have been able to, is through the power of data analytics. And this is taking us back to something that Amy Acton said. She had the foresight to bring in one of the world's premier modeling teams in to help the Ohio Department of Health, in to help the governor's office. And it puts us on par with the likes of Cornell, Harvard, Yale, Emory. We can add OSU to that group. They were here before, and they needed that opportunity to step in and serve and shine. And so we were a premier team before, and now everybody is aware of the power of the data analytics group here. And part of that power comes from connection to the university, math, geography, virology, public policy, engineering, the Infectious Disease Institute, the Data Analytics Institute. But there's no question that the core of this effort is coming from public health. We're the hub that is bringing some of these world experts who are here at OSU together to solve these problems with the state health department, with local health departments as well. And we have partnerships with both Franklin County Health Department and Columbus Health Department. And in fact, we're at the moment crystallizing a project to create a sustainable, right now we're calling it a computational epidemiology lab. And this would make sure that these elite faculty members, these elite researchers that we have are here for the long term to serve the nation, to serve the state, to serve the city, the county, the university, and advance the science of data modeling and data analytics at the same time. And the reason we need to institutionalize this computational epidemiology lab, and this takes me back to really answering your question, is this a once in a lifetime, once in a century event? It's very likely not to be. We have to count on COVID-19 as being a harbinger of things to come. So I'm a historian, and one of the things that I read when I was doing my dissertation, which became my first book, is a line from Shakespeare. It's from The Tempest, of all things, inscribed outside the National Archives, and it's "The past is prologue." So the past is prologue. COVID-19 is a harbinger of the things to come as the climate changes due to our own human interventions and human operations in the world, as the human herd and the animal herds come together and interact in new ways. And one of the most important steps that we can take right now is here at OSU to create the kind of structures that are going to advance science, support our local health departments, our local communities. And we've been doing this remarkable work together, but we need to be stay ahead of future threats. That takes significant investment. It's going to take significant investment to formalize and expand these kind of resources.
Well, we're not through this one yet. So putting in place the structures that are going to help us now clearly makes sense. We can't be the chief health strategist. We can't have a just healthcare system unless we have good transformational data to help us get to that leadership point. So thank you for that. And that might have been an announcement. That's interesting. I have to follow up. We're all curious about that. So Dr. Acton, grateful community members both here in Ohio and actually beyond have recently helped establish a student scholarship in your honor here at the college. I'm excited to report that this fund is growing every day. Yay. Will you share with us what the Dr. Amy Acton Future Leaders of Public Health Scholarship means to you, and why it's important to champion students who have overcome hardships and who have diverse backgrounds and life experiences?
Wow, well, I just want to piggyback on something Dwayne just said about, and this is something my students and I talked a lot about. My favorite part of teaching was office hours because you really got to understand people's stories. And we're all on these journeys. I'm 54, it doesn't end, just note to that, but of discovering yourself. And we talked a lot about in our class about finding your compass and your passion. And public health students were an amazing group. Again, they were very interdisciplinary. They loved the natural sciences and the social sciences, but they had a sort of social justice bent. And, in the stories of office hours, I really did meet students who were really having, all different kinds of life backgrounds, and were carrying a lot also with them to school. There was one student that really stood out to me. She was on a very special scholarship that starts in 6th grade, actually, with students, and works with them all the way so that they someday come to OSU. And when I was in office hours, she was telling me about all these jobs she was working. She was working like 3 jobs, and I thought, I thought you had this full scholarship, because I was trying to help her balance her studies. And I realized in talking to her that she was supporting her family back at home on her scholarship. And looking into that and realizing, that's something that we might not have discovered or been able to talk and help her find her way to do both, or even help her family understand what her new world was like. So, I shared a little bit about my childhood during the pandemic, and I realized that so many of my experiences as a kid have shaped who I am, for better and worse. That's where your strengths come from. And so right at the time of this crisis, one of the ways, we started working on the pandemic the 2nd week of January, and I was in the White House in the week before the Arnold. And I think because of my hypervigilance that I developed in childhood, I was able to pick up on a lot of the clues and found that I was very good diagnosing and also being on in a crisis. I'm a lot worse at ordinary life, but in that moment, I can zoom and focus. And so it's interesting that some of my very background, whether it be experiencing homelessness or other things, helped me navigate in weird ways the crisis. That's where my strengths came from. And the other thing I discovered, and I'm still discovering, honestly, is voice. And so I really hope that students who benefit from this find voice, and find the nurturing that the College of Public Health is so great at wrapping around. and that those diverse voices are really going to help us create that different system that will really represent the people in a very human-centric kind of design way. How we design our systems really needs all those lenses. So I will say too, I know that the scholarship started coincidentally by a mom who was home with her kids in the beginning of the pandemic, getting involved, and they created a yard sign, I guess. I feel like I should tell a story because there's so many people who have supported me on this journey. And the sign said, act on love, not hate. So as a play on my last name, I married into this name. I would have never thought of it, but the signs, I guess, spread during this time that we've been through. And she took all the money people sent her for them and was looking for some way to help students. So this really goes back to them and the people who joined her in that effort. So I hope that their work lives on this way. Thank you.
So act on love, not hate. And Amy and Dwayne, and actually both Amy's, the message around paying attention to both listen, to use your voice and to listen to other voices, the power of storytelling, and even office hours. So hopefully students will continue to use office hours and faculty will continue to both appreciate them and to listen for the stories of their students. So that's really powerful. Thanks, Amy. Or Dr. Acton. Mr. Reynolds, CPH is proud to be the home of the 7th ranked Masters of Health Administration program in the country, according to US News and World Report. Yay. There is no doubt that our students today will be future leaders in this arena, in this industry. With many of them listening right now, what words of advice or encouragement do you have for them? And where do you see their generation leading us?
Thank you for the question. And first, I'll say that in my eyes, the Masters of Health Administration program is the #1 ranked program in the country. And I've held that ever since I was a part of the program. So in thinking about the advice that I would give to students, first, I sort of harken back to what I said earlier. Follow your passion, and where there is no path, make one of your own. And that means that at moments, again, you're going to feel lost. You're going to feel like you don't quite know where you fit. And in particular, now speaking to minorities and women, oftentimes our voices are overshadowed and we don't actually know our own power. And so part of what I think you have to do is to find your own power and your own voice, be confident in that power, and use it to make change in the world, because our perspectives are what will make us better as a community, as a society. Everyone's perspective being heard and valued. And so we have to move ourselves beyond sort of the limitations that we have once placed on our abilities to rise through organizations to make sweeping change. Knowing who you are will allow you to do that. So make sure that you become comfortable with who you are, because who you are is your greatest gift. And when it comes to the complexity of going through careers in your personal life, I've also found that sometimes the greatest growth that you can have is right in the center of that complexity. So learn to become comfortable with the uncomfortable, because on the other side of that, you are getting closer to who you're supposed to be. And I have great hope for what this generation will do and where they will lead us. When I think about the social unrest that has occurred in this country, it is really about the younger generation who has stepped up and said no to what our country has been. It is no longer acceptable to folks who are younger than me to really have what we've had in terms of racism. And so I am inspired by the voices that have come forth, both of marginalized groups, but also of dominant groups who are joining the fight as allies. And so I see major change on the horizon in terms of our ability to impact health equity, our ability to find value in one another, which will help us solve some of these solutions. And as Dr. Acton and Dr. Fairchild pointed out, our connection to one another and multidisciplinary work together is actually how we will solve many of these issues. And when I look at that and the lens that I hold, I'm always thinking about the fact that our diversity is our greatest strength because it allows us to look at complex issues and really get to great solutions.
Well said. And that interconnectedness of all that diversity. I love the notion of finding our power as well. Not easy to do sometimes, but really, really important. Thank you. Dean Fairchild, back to you. COVID-19 and racism are not just coexisting public health crises. We're seeing their paths cross. We're actually seeing them expand with devastating consequences, interplaying with each other. Many populations are being hit disproportionately. What work is the college doing to overcome injustice and improve health for those who are made vulnerable by structural inequities?
Thank you, Teresa. Well, this gives me a chance to just riff off a point that Dwayne just made. Diversity is excellence, and we're in the business of producing excellence. And you have two prime examples here tonight in alums like Dr. Acton and Mr. Reynolds. We also have alums like Naomi Adenea, who's working at the Department of Justice and understands the complexity of the ways in which law enforcement is both a broad system that includes not just the police, but the drug enforcement system, the prison system, the immigration system, just to name a few of the components, a system that both contributes to systemic violence, that both perpetuates racism, but at the same time can represent also a resource that can benefit communities of color when communities are involved and have a say. Now, I can't highlight all of our faculty and our alums who do things, but in terms of our faculty, this is a theme that runs deep throughout so much of our work, not just in one division, but in all of our divisions. I'm going to give you just 4 examples. So Dr. Juliana Nemeth and Taslim Padamse are leading efforts in a partnership with the Ohio Department of Health to identify and address the needs of those who are most vulnerable to the challenges made worse by the COVID-19 pandemic. These include poverty and domestic violence. And there was a piece on NPR on the rise in domestic violence just this morning. And you'll all be hearing more about that work soon. And I'm also happy to say that their research will continue full stream ahead thanks to a recent and very generous gift from 2 of our remarkable College of Public Health family members. Thank you. You know who you are, and you know how grateful I am to you. I'd also quickly highlight the work of Dr. Janelle Ricks. Her work examines how societal factors coalesce to affect health outcomes. So how all of these structures intersect to create a lack of opportunity, a lack of choice, and shape life chances for folks. She's led a recent study that found Black men who had been incarcerated reported recent sexual behaviors that were more risky than those who had never been in jail. And Black men are much more likely to be incarcerated than white men, and are at much higher risk for HIV/AIDS and other STDs. So finally, I would talk a little bit about the work of Dr. Shanita Seeley Jefferson. She leads what's called the SEED Lab. It's the Social Epidemiology to Eliminate Disparities Lab. And it was one of the things, I gotta tell you, that excited me so much over a year ago when I began to interview for this position. So SEED is currently seeking solutions to the disproportionate infant mortality rate among Black women. And this is especially pronounced in Columbus. In 2018, Dr. Celia Jefferson started an undergrad course in social epidemiology. It is one of the real signature courses within the field of public health and certainly within this College of Public Health. And that course examines how the distribution of advantages and disadvantages in society reflect the distribution of health and disease. So these are just a few of the folks that we have, and in teaching and doing this research, our faculty are also at the forefront of helping students find their voice, sound their voice, test their voices. I mean, it can be scary. And one of the themes I hear a lot is that, and this was my own experience in finding my own voice. We're going to make mistakes. And there is no better place to find, to test, to make mistakes, and to start again than in a higher education institution, and certainly in a college of public health.
Wow. I really appreciate, I know everyone else will appreciate hearing some of those examples, and I know that there are many more, but those are very powerful. And just as we were gathering tonight, I thought I would love to spend an hour or 2 hours with each of you to really delve into this. Our time is going fast. So I'm not going to get to all the questions, but I will ask one final question of each of you. So darn, we'll have to come back and do part 2 because we had some good questions, from our audience participants as well. But let me ask one question to each of you, to all of you. It's the same question, and we'll go around to Robin again. But it's clear that students at the College of Public Health will have a major role in the future of public health and healthcare. So what can we all do? What can we all do to ensure that their voices are heard and that they are able to serve to guide advances in policy, in research, and in the public health field as a whole? So looking to the future, we'll start with Dr. Acton one last time.
Well, I taught the Gateway class of undergrads for many years, and I can honestly say I learned much more from them than I ever taught them. I had a wonderful graduate student, Chris Ray, and somehow we caught this gesture, which I actually used at ODH, including many of the ideas of my students, but it was, he would do this thing and he would say, permission to scheme. And that became, because we had sometimes up to 100 students, we got to know everyone in the class. We, through those office hours, figured out what they were passionate about. And when my class was taught, it was the beginning of TED Talks. So the students would take, and I just said, public health is so broad, I dare you, you just tell me what your passion is, we will find a topic. Like there's always a thread. And students just really took that and came up with these amazing things, many of which they went on to do and implement, even as undergrads. I do believe Encompass still exists, Empowering Neighborhoods of Columbus. That came out of a class. Students saw a talk on how undergraduates were filling a huge gap in healthcare based on the Health Leads model, where they would sit in waiting rooms and help connect folks to all their other needs, instead of just downtime sitting in waiting rooms. And that expanded and expanded, took off on campus, and still exists. And that came out of a little special incubator class we created just to take the step. So I saw firsthand what students were already doing even as undergrads. And I think, involving them as you are, I can just feel it. I can just feel the culture. Dean Fairchild of the college and Dr. Long, what you are creating. Again, the students are really the whole center of it. And we have the ability at the College of Public Health to have basically like a small liberal arts college right within the whole giant campus of OSU. So it's just a precious gift And students, I'll tell you, Dwayne's advice was so good. It is a journey, and just keep, lean into those things that resonate, lean back when they don't, and you'll just keep honing that compass, and it won't be a straight path, but do that, lean in, try things, tolerate those discomforts you mentioned, but you'll know, and it's really, if you can hold on to that thing that really makes time fall away and just frees you, or you're in that zone, just hold on to that. The other things will work themselves out, but that will really set you and set your voice free. So I think over almost a half of the public health workforce, which lives everywhere, not just in state or local health departments, but in all fields, is retiring in the next 5 years. So you are needed. I really believe you'll be the drivers of this next modernization and help us realize that full flourishing and potential. So thank you, and I'm so excited to see what you do.
Thanks. Well, Dwayne, how about you? Do you need me to repeat the question, or you think you have it?
I think I got it. So, I think we have to create intentional spaces for the students to give and express their opinions, their thoughts, their lived experience. As I think about how the healthcare system changes, it has to change based off of people's lived experience, and the students are no different. And so their perspectives of how the future should be really have to be honed and listened to in very intentional ways. Sometimes, as you move through your professional career, you become a little bit hardened to the rules of the game. What I love about being a student is you have this freedom, this opportunity to explore, this curiosity that can actually help innovate, and harnessing that power from you is what will actually make us a better society. And so making sure that, inside of our organization, those of us who are out in the field, pulling students along, giving them the opportunity to flourish and to contribute in real ways within our organizations becomes very critical. Making sure that students who may be in disadvantaged groups have the support that they need to get through college and the experience of, so that they can contribute those diverse perspectives is really critical. And so I'm super excited. You think about the time that we're living through right now, and there are so many opportunities to think about the negative, but the positive is there's so much that can be changed and transformed as a result of what we're experiencing now. And so the sky's sort of the limit here. Like it's like a do-over in some ways, because it's given us an opportunity to really think about humanity, about health, about our connections as human beings. And so I just believe there's a great opportunity that these students are already taking advantage of and will continue to lead us into the future.
That's terrific. And the notion that it's the future, and maybe some of us have a do-over opportunity as well.
Yeah.
And Dean Fairchild, how about you?
Well, let me pick up on that last point that Dwayne made about students needing the support to get through. People have been so successful in finding their own paths, in creating their own paths, but we also have an obligation to help clear those paths whenever and wherever we can. So one of the things I would like to highlight again is to come back to where we began, is student scholarships that are focused on diversity and inclusive excellence here at the college. We had 3 established in the last year. The Moore Scholarship, which focuses on first generation students, the Acton American Scholarship, which focuses on students who have overcome adversity. And you heard Amy talk about some of sort of her inspiration for that and the ways in which she was inspired by the creation of that scholarship. And we also had a faculty member, the Hood Memorial, create a scholarship in the name of his parents. And why that's important is that this is a panel of, it's not just one, it's a panel of scholarships that prioritize students who have such great promise and who we need the most in the field right now if we're going to truly achieve diversity, if we're going to truly achieve inclusive excellence. Remember, I said that diversity is excellence. So first generation students, African American students, students who have overcome significant hurdles to arrive on the doorstep of this college. And we need to make sure that those doors are open, and if they're not open wide enough, we need to tear down the whole front of the building to make access as easy as we can. But establishing these funds is only the first step. We need to build them, and we need to grow them to make sure that they have the impact that we all know they must have.
Well, wow, diversity is excellence. And that is the way forward. That is part of charting our path 2020 and beyond. So thank you, both Dean Fairchild, Dean, Mr. Reynolds, Dr. Acton. Thank you so very much for your time and your sharing of your thoughts and passion. I still would like more time with all of you. I'm sure others would too. Our audience, thank you for joining us as well. We are thrilled to have had the opportunity to bring our College of Public Health family together. Please look out for other opportunities coming up for these important kinds of conversations. We'd like to keep them going. And please, at this point, just a moment of personal privilege. We've heard so much about voice and power. Now is a time for us to raise our voices in our communities, across our nation. I urge you to use your voice and to vote. Our voting is our voice and our voice is our vote. So now is such an opportunity. And again, thank you all for participating. Lots and lots to think about and continue discussions. I'm sure we will. But again, thank you everyone, our panelists and everyone for joining us. Have a wonderful evening.